My name is Dr. Shashikant Kammar, Associate Professor, Department of Forensic Medicine and Toxicology, Yenepoya Homeopathic Medical College and Hospital, Yenepoya deemed to be University. Today's my topic is prognosis of the case based upon the 12 Kent's observation. So the basic objectives of my class is, or the session is, you will be able to understand the concept of the acute and chronic diseases. You are going to be understand what actually the principles of administering of homeopathic medicines and identifying the criteria for the repetition of homeopathic medicine. So first, we should know what actually the acute and chronic disease is. This is explained in Organ of Medicine written by Dr. Samuel Hahnemann in aphorism number 72 onwards up to 80. So he has told here what actually the acute case is and what actually the chronic case is. The acute case is sudden onset, fast prognosis and decline with the recovery or death of the patient will be. For example, the person who is having the acute conditions like rhinitis and all, it will be cure its own. But at the same time, if the acute condition like myocardial infarction, that also comes under sudden, means onset is sudden and the decline with the death of the patient will be there. That's acute conditions. And chronic also is told, where it is told that the onset is very insidious and the prognosis is there and there will be a decline. So this takes more time. Chronic condition always takes more time. Insidious onset means slow and steady onset of the disease without or with the awareness of the patient. Then how to approach this case? So acute and chronic case both should approach the same. Means you are going to take the case in detail. You are going to find out the characteristic features of that condition and you are going to administer the medicine based upon the signs and symptoms presented by the patient. What are the principles of administering of homeopathic medicines? We all are knowing that there are 7 cardinal principles of homeopathy. Other than that, we should see what actually the nature of the disease is and the susceptibility of an individual, what is the primary and secondary action of the medicine and the Kent's observation. Based upon these principles only we are going to administer medicine. Nature of the disease in the sense, what is acute condition or what is chronic condition. Nature means whether the disease is deep-seated or superficial. Nature of disease means it is a acute condition, we are approach is different, like acute totality we are going to construct and chronic case we are going to find out the totality of the symptoms in depth and all. So this is about the nature of the disease. Based upon this, we are going to select the medicine which is a lower potency or the higher potency. See, all these depends upon the susceptibility of the individual. If the susceptibility is low, the case is in a chronic case where you are going to find out the low potency. And if at the same time, if the case is chronic in nature, so we are going to find out the lower potency over there. So acute condition, higher potency, chronic condition, lower potency. This is the principle which we are going to apply it. Now, what is the primary and secondary action of the medicine? The medicine which we are going to apply to the person, the vital force is going to react to that. And once this is reacted, how the signs and symptoms are produced by this vital force on the body will come as the primary actions. The secondary action means how this body is reacting to that. That is the secondary actions. Then next one is Kent's observation. This is the very important point based upon which the homeopathic medicines has to be administered after the follow-up, during the follow-ups. Okay, so what are the criteria? There are certain criteria based upon which the homeopathic medicine is administered. Those are the Kent's observations. There are 12 sets of the observation by the Dr. Kent and even by Dr. Hahnemann. Hahnemann himself has started all this in his aphorisms. He explained all this in depth. The Kent has told in systematic way that a prolonged aggravation and final decline of the patient. This is the first observation of the Kent after administration of the medicines. Once the patient has come to you, give the medicine, after during second follow-up, how this first medicine acted upon that is going to understood during the follow-up. In follow-up, what happens, how this medicine acted. Whether there is aggravation, what type of aggravation. If the aggravation is a prolonged aggravation and patient feels that he is not happy with that, there is certain changes or pathological changes occurring in the body, that condition is coming over there and that is unfavorable conditions. So during unfavorable condition, what is to be done now? The unfavorable means the prognosis is not at all good. Prognosis not good, and what is to be done there? So what is our inference over there? The inference is that the medicine, whatever it has given, it is a deep seated medicines, or you can say deep acting medicines. So medicine which is required, the dose which is required over there, the potency which is required there, that has not been given. The medicine is the dose is changed, deep acting medicines we have applied over there, and because of that only we are going to observe the pathological changes in these conditions. So that is unfavorable. Then what is to be done now? Now you have to retake this case. Retake the case and find out the missed point which you are done in your first settings. So retaking the case and finding out the new totality of symptoms is the only option over there, and before that you should give the medicine which is going to nullify the effect of the previous medicine. That is called the antidote medicines. So the best antidote is nothing but the same medicine in the lower potency, that will come as the antidote. Okay, so this you have done it. The next point, find out next medicine and give that appropriately correct potency, maintaining the homeopathicity whatever studied there in aphorisms. Fine. So this is first observations. The next observation is the long aggravation but final and slow improvement. If you see, both are similar like, but there are changes are there, that is at the end. First one is tells that final decline of the patient, and second one tells that slow improvement. So if it is slow improvement is there, this is the favorable condition. The prognosis is good over there because improvement is there at the end of the treatment, at the end. Okay, after the aggravation there is an improvement you are going to find, whereas you are going to see the final decline in the first observations. So first observation, retake the case, okay, and find out the new characteristic symptoms and find out the new totality and prescribe the medicine. Long aggravation but find a slow improvement, which is the second observation, which is a favorable. Why it is favorable? Because there is a long aggravation. Might be remedy is correct, might be the dose is correct, the problem may there in the potencies, or else potency is correct, medicine is correct, the dose is not correct. So there is slight change way to do it here. So here you should give the same remedy in the lower dose and the a bit higher potency over it. That's the first thing. The second thing what you are going to do is, you are supposed to take a case once again and find out which is the remedy which is follow well to this particular remedy which already you have been given, or else the complementary remedy. Here the medicine is not acted completely, so we are supposed to give the one more medicine that is called as the complementary remedy to the previous one, so that previous remedy is going to complete its action and then it will show its better reactions. This is the second observation. The third observation, aggravation is very quick, short, strong and with rapid improvement of the patients. So this is a very, very good, I can say, the best observation out of all these 12 observations in acute condition, not in chronic condition. So aggravation is quick means what? Whatever the medicines were given, the remedy is correct, the potency is correct, the dose is correct. So during this process, we are going to get the homeopathic aggravations. I think people are knowing what are the different types of the aggravations. Homeopathy aggravation is there, medicinal aggravation is there, disease aggravation is there. So out of these three, we should find out whether this is a homeopathy aggravation or any other aggravations. So how to differentiate it? The aggravation which is coming quick, short and strong and rapid improvement, as we know, this is the homeopathic aggravation. The disease aggravation means the symptoms which are present in the medicine which is going to act on the body. So those symptoms are coming up, that is called medicinal aggravation. And disease aggravation means the disease is going to be flared over there and those symptoms will come up, that is disease aggravation. So medicinal aggravation, it will come its own and it will go its own because it is a self-relating. So it is going to act and it is going to relieve its own. Whereas the homeopathy aggravation is aggravation very fast, quick and short. So this is the differentiating point, you should know it. Okay, so what is to be done over here? Now, as we have observed that aggravation very quick, so this is going to relate to the aphorisms. If you see aphorism number 2, where it tells about the ideal cure. When you will get the ideal cure? We are going to get the ideal cure when we are prescribing according to the basic principles of homeopathy, that is law of similia, similibus, and all those 7 cardinal principles. We have to follow it, and we are getting the homeopathy aggravation there. So this is one relation to the aphorism and the third observation. And at the same time, you should see about the 7th aphorism, where he has told about the symptoms or totality of the symptoms. Select the symptoms which is clear, very characteristic to the individual. For example, thirst is there. Thirst is common to all, but how you are going to find out this thirst is a characteristic of the patient. He is having the thirst during the fever is common. Okay, he is not having the thirst during the common. It is in the fever, during fever it is uncommon. So like that, which is common things are there that has to be characteristic that has characteristics in the diseased people. So that you have to catch it out and put it in your totality of the symptoms. So that is a characteristic. Such characteristic symptoms should be there in your totality of the system. This is what the aphorism number 7 has been told over there. Okay, same thing aphorism 152 also told about the characteristic symptoms. That means whatever the case is there, the characteristic symptoms you have to collect it and prescribe the medicine based upon the totality of the symptom. So if you do this, you will get the homeopathic aggravation. Or if you won't get homeopathic aggravation, I can say that that is not at all towards the prognosis, which is good. That is wrong. So homeopathic aggravation has to be there in your acute condition. I am not talking about the chronic. In acute condition, homeopathic aggravation is must. Okay, so in this condition, you just wait and watch what is going to happen in further few minutes. Okay, there is amelioration of the signs and symptoms. That is also a good thing. Patient tells that, yeah, I'm right now I'm feeling better. Acute condition I'm talking about. I'm feeling better. So that time you should not give any sort of the medicine which is going to disturb the flow of the homeopathic medicine which already you have given. If you give it, what happens? There is a flow of the that medicine is going to be disturbed, and there is a possibilities of the aggravation of the conditions. So better don't do anything for that conditions. Wait and watch. Patient will find that thing. Okay. The next one. There is no aggravation at all with the recovery of the patients. No aggravation, good thing. With the recovery of the patient, that's also good thing. So the prognosis is very good here. So why it is happening? Because we have given the right remedy, right potency and right dose over here, and the prognosis is good over there. Not very good, a good prognosis. Once the prognosis is good, give the complementary remedy to this patient so that the action will be completed over here. Okay. The next, the 5th observation is the amelioration comes first and the aggravation comes afterwards. This is unfavorable conditions. Amelioration comes first means when we are given the medicine and there is a feeling better, and then aggravation. So this is not favorable in case of the acute conditions and all. So if acute condition, primarily there should be the homeopathic aggravation only. No amelioration. If at all there is no amelioration, so no aggravation, only amelioration is that is a good point. But here the amelioration comes first and aggravation comes afterwards in the 5th observation, which is unfavorable. Okay. So here unfavorable condition, again take the case, restudy the case, that is called an anamnesis if you are remembering the points. And do the anamnesis of the case, what you have missed in previous case, find out that particular point and put it in your totality of symptom and prescribe the remedy according to new totality of the symptoms. That will give you the good result. So this is what we observed there, and we are given the medications. The next one will come as the too short relief of the symptoms. That is bad in chronic condition, too short relief of the symptom. Means patient took the medicine and for time being there is a relief of the symptoms, but again there is a relapse of the same conditions. So that is a bad in case of the chronic condition. It should not happen. There should not be, relief should not be too short. A relief should be there, but it is not too short for time being. Just given medicine, after 1 or 2 days there is a relief. Again after 5 to 6 days there is a symptoms are reappearing. One point I want to tell you that the reappearance of the symptoms after the medication, it is more intensified than the previous one. So this short relief and more intensified symptoms which are coming after a particular time, that is a bad sign in the chronics. Here I can tell one example is that the person who is suffering from, I have seen the case, the person who is suffering from this hemorrhoids, we given the medications like carbovage and all, we are given the medicine, at time being it is fine, subsided, but again it is relapsed and more intensified along with the other symptoms called as the, there is one condition called as the infection along with the strictures. There will strictures will be there. At the same time, there are certain fistulas coming over there. So this fistula in ano is again the symptom of that particular diseased condition which is coming after medications. So this should not happen. Relief at the beginning, patient is finding relief, but afterwards intensified symptoms along with the new symptoms will be there, which is a bad in the chronic case. So take the case correctly, prescribe the medicine accordingly, whatever the patient is asking, means telling you, consider what it is and then prescribe the medicine as per that totality of the patient's disease condition. Okay, this comes under the 6th observation of the patient. The next point is full-time amelioration of the symptoms, yet no specific relief of the patient. This is a bad observation. See, once you prescribe the homeopathic medicine, what is going to happen? Patient should come and tell doctor, I am feeling better, though the symptoms are there, as in cases. So the rashes on the body and all, patient is uncomfortable with those rashes. We prescribe medicine and after the patient is telling that I am fine, I am better now, but still there's some symptoms, rashes will be are there on the body. This is what the patient is told. So what is this? This is the betterment of the patient. If there is feeling betterment, that's a good sign. But here what is a full-time amelioration of symptoms, yet no specific relief of the symptoms of the patient. Patient is not telling that I am fine over here. Patient should tell that I am fine, I am feeling better, those symptoms are there. That's a good sign. But here it is a absolutely bad sign. Some patient prove whatever the medicine or remedy they get. This is also the bad condition. So what happens here? This is 8th observation. They are start proving the medicine. In such condition, we should antidote the case. After antidoting the case, we should start the lower potencies like 30th potency and 200 below 200 potency, which is start with the case and prescribe to the patient who starts proving every remedy. This is coming under idiosyncratic condition of the patient. Okay, so this is about the 8th observation. The 9th observation, the action of the remedy upon the prover. So this comes under the proving. During proving, how the medicine acting on the patient, how the patient is showing these symptoms externally. This comes under, as I told about 63, 64, that is Apperhouse number, primary and secondary action of the medicine on the vital force and the reaction of the vital force upon the medicine. So this comes under the remedy upon the action of the remedy upon the provers. So here this is entirely about during the drug proving and all. The next one is new symptoms appearing after the remedy. What's the need of appearance of the new symptoms? Our intention is to cure the existing symptoms, not to produce any new symptoms over there. So if the new symptoms are coming up, so that is the bad prognosis. Absolutely bad prognosis. So here also we should retake the case and prescribe the correct remedy. Before giving the medicine, you should antidote the previous. It is must that we should antidote the previous medications. Without antidoting any medication in such observations should not be done with the next prescription. So prescription should be done after the antidoting. Okay, so new symptoms, it's a bad sign, whatever the new symptoms are there. So once the new symptoms are, so you should understand it, what are the new symptoms, whether the new symptoms are belonging to the medicine, whether the new symptoms are belonging to the disease. So these are also again called as the accessory symptoms. Accessory symptoms of the disease, accessory symptoms of the medicine. If the accessory symptoms comes there upon the medicine, what you are supposed to do? Here you are going to wait and watch, because this is produced by the medicine, it will go its own. But the symptoms which are coming from this disease condition, it will remain there. So disease condition, the symptoms which are there, we have to take it. Accessory symptoms of disease, we should take it. Accessory symptoms produced by the medicine are not supposed to take for your next totality. Okay, so after this, next we are going to see about the old symptom are observed to reappear. This is also one of the very good observation. There are two good observation, one is the third and one is the 11. Old symptoms are observed in to appear. So this is in the chronic case. You start giving medication, old symptoms, see there is one chronological totality is there, where you have taken the case and you have written since when this particular symptoms are appearing, these symptoms when it has started, how it has started, what is the time duration of that. That means chronologically you are arranging all totality of symptom, and after selection of the medicines, you prescribe the medicine, you should see that which symptoms has disappeared first, okay, or which symptoms reappeared first. So this is nothing but the Hering's law which you are studying, that is from within outward, from above downward, from most to less important organ. So this is going to tell about the Hering's law. Old symptoms reappears, it's a good chance, good prognosis, and here you should not give any medication. Don't alter that flow of the medicine which already it is taken place in the body. Okay, here wait and watch, and you will get the good result over here. So for satisfaction of the patient, you just keep the patient on the PL or the placebos. That's very good. Otherwise, what happens? You're going to disturb the flow of this medicine, and the entire disease picture is going to be collapsed. Okay, so don't do anything here. So last observation is the 12th observation. Last is nothing but the symptoms they take wrong direction. That means it is a suppression. This is also called as suppression. Wrong direction means our intention is they should follow the Hering's law of cure. If it is not following the Hering's law of cure, means it is a bad prognosis. Symptoms should disappear from within outwards. That is what we have studied. But here the symptoms are disappearing from outward and then going inside, and inside symptoms are disappearing. This is a wrong direction. Or else from the skin it is going to the lungs. This is also wrong direction. From the skin it is going to this interior, like heart or the spleen or some kidneys. So this is also the wrong direction. It should not go like that. It should go from within outwards, from most important to less. What is the most important organ in the body? If I ask, definitely we may say the brain or heart and all. So it is correct, but there are certain layers based upon which the organs are formed, which you already studied there in embryology and all. So which layer, which organs is forming, and based upon that the direction is going to be considered over there. So that first you should understand which direction they are formed, and accordingly that only the symptoms should disappear. That is nothing but the from Hering's law of cure. So this is about the symptoms that takes wrong direction, or you can say you have studied that is deflected current. Okay, that one topic is there, and that is in philosophy. So that is also telling about the wrong directions. Okay, so that is also telling about the suppressions and so on. All these 12 observations are very important. Based upon these 12 observations only, our next follow-up depends. So the most important is the third observation, and the old symptoms starts reappearing, that is the 11th observation. So based upon that you can consider whether acute or chronic, or what remedy you have to select, whether to antidote or not. So observation is a must, each and every case. After, see, what do we think that once we prescribe the medicine our duty is finished? No, that is wrong. When our duty, real duty starts when we are going to see the follow-up. In follow-up, what patient is giving, that you should consider, and depending on that what medicines you are giving. Repetition of the medicines, really it is very important in case of the acute condition as well as chronic condition. Repetition is done based upon the previous action of the medicine. So if you are given the medicine and if you are finding the third observation, repeat it, don't wait, repeat it in the higher potency. That is, if you are given 0/3, you can go use the 0/6. So what happens? The action will be very fast over there. Okay. So this is how the repetition is needed. Don't give the same potency, same medicine, same potency and same dose in the next follow-up. It is going to alter the flow of the previous medicines, and you are going to spoil the case. Remedy or potency should be more intensified than the previous one. This is what the message you are going to take home. Okay, observe the case, find out what observation is there, and give the next medicine based upon this 12 observation. This is the message you are going to take at home at the end. So here I am going to close it. Thank you very much for listening carefully. Thank you.